I am Dr. Suresh Ramchandani. I am a Vitreoretinal surgeon and the medical director of CFS Nerul. Diabetes is a very common disease. In fact, every one of you must be aware of some person who has diabetes in your family. Diabetes is going to afflict so many people that India is going to be the diabetic capital, or is even now a diabetic capital of the world. The eye is affected very commonly in diabetes mellitus, and the other organs which are affected are the kidneys, the feet, the heart and the brain. What happens in diabetes and the eye is that the vessels get damaged, and because of which we get leakage of fluid into the retina. This leakage of fluid causes thickening of the retina and it damages the sensitive structures of the retina. Other thing that can happen is that the vessels can rupture and you can have bleeding in the eye. So when the retina gets thick, the patient gets a blurry vision, and when you get bleeding in the eye, you get floaters in the eye. How is the diabetic retinopathy treated? Diabetic retinopathy is treated by a strict control of diabetes and checking your blood levels of serum cholesterol, serum creatinine, taking care of your HbA1c, and also checking whether you are having any thyroid problems. After you have developed diabetic retinopathy, then the treatment modalities that are available to us are: 1. We can do laser to seal the bleeding vessels. 2. We can give you multiple injections which can reduce the swelling of the eye. And 3rd, in very advanced cases, surgery will have to be done. But prevention is the cornerstone, and hence I would expect everybody to take care of their diabetic status and help us to prevent the complications of diabetes in the eye.
Follow Center for Sight and post your queries to get answers from the experts.